Hello and welcome. Thank you for joining us for another webinar about the NUCA system of care here at South Central Foundation. Today we're going to be talking about recruiting and behavioral-based interviewing for best fit. Our presenters today are Karen McIntyre, who's the Director of Human Resources, and Barbara Sappa, who's our Senior Human Resources Manager. My name is Gil Prickett, and I'll be your moderator today. If you have any technical issues during the morning accessing the webinar, please contact our technology support specialist, Luke Benson-Carlo, at 907-268-7078. Texting probably works best for that. He'll be able to respond more quickly if you text. We've got a couple of different ways in which we're going to be asking you to interact with us today, because we want this to be as interactive as possible. The first one is using the built-in question and answer function in MediaSite, which is the platform that you're using to view the webinar. If you look in the lower right-hand corner of your screen, you'll see a little text bubble there. If you click on that, that will open a text box that you can fill in with your name, subject, and message, and click on Ask Question. That'll come directly to me, where I have it on my monitor here, where I'll be able to see it and respond. You can ask us a question at any time during the webinar. If something comes up that you have a question about or you want more clarification, please feel free to use that at any time. Another tool that we're going to be using today is a polling tool called Mentimeter. And we're going to be using this at several times throughout the presentation to get direct live feedback from our participants. The way to access this is to go to www.menti.com, and you can do that either on a mobile device or on your desktop computer or laptop computer. And you're going to enter the code 657495. And that's the code for this particular presentation. You should only have to enter that code once, but make a note of it in case you need to use it, in case it asks for it again. We'd like to practice using Mentimeter right now. We'd like for you to go onto Mentimeter and share your name and your location so we know who we're talking to today. Want to know who's out there. That helps us know maybe some of the questions to expect and try to make sure that we're just aware of things that might be going on for you wherever you're located. So again, please share your name and your location by going to www.menti.com and using the code 657495. While you're doing that, we're going to do a couple of other things before we look at the results of that. The first thing we're going to do is look at our objectives today. Our objectives for this webinar are to summarize how behavioral-based interviewing is used as a tool to support South Central Foundation's approach to ensuring right-fit hiring. We're going to examine how South Central Foundation aligns workforce competencies in behavioral-based interviewing to support the vision and mission of the organization. And we're going to describe how implementing a centralized interview process improves the hiring and selection of new South Central Foundation employees. We've asked you to tell us a little bit more about who you are and where you're from. We're going to do the same right now. I'll start with myself. As I said, my name is Gil Prickett. I work here at the South Central Foundation as a clinical advisor in our development center, which is the learning and development wing of the organization. I've been here at South Central Foundation for 13 years. Most of that time spent working in a clinical role as a behavioral health consultant and clinical supervisor, and with the Development Center for the past 2 years. Alaska is not my home of origin, but it is my home now. I've lived here for 18 years. This is where my children have grown up, and this is where I plan to stay. So I'm really excited to be here today as a part of this panel to share with you more about the NUCA system of care. I'm going to ask our presenters to introduce themselves now as well.
Yes, good morning. My name is Karen McIntyre, and I've worked for South Central Foundation for 20 years. I've been the Human Resource Director for the last 2 years. Prior to that, I was the Director of Organizational Development. I am what we call a customer owner. I utilize the services here. I'm Alaska Native. My mom's family is Yupik and Serbian from the Kuskokwim River, and my father's family is Russian and Aleut from the Pribilof Islands. We're excited today to share with you information about how we select employees to work here.
Thanks, Karen. Good morning. I'm Barbara Sappa. I am a Senior Human Resources Manager in the Human Resources Department. I've been at South Central Foundation for 11 years, and I've filled various roles throughout the organization supporting workforce development over the course of that 11 years. I am also a customer owner or patient here in the system, so are my children. My family is EAC, and we are originally from the Cordova area. And we're happy to have you joining us here today.
Thanks, Karen and Barbara. I'd like to look at your responses now to our question about who you are and where you're from. So we've got several folks that are joining us today. Looks like we've got Larry from New Mexico. Thank you for joining us, Larry. We've got Manny Horowitz from Sheboygan, Wisconsin. Manny, thank you so much for being here with us today. Chris from Seattle. Wonderful. Sharon from, I believe, Ohio. Okay. I'm going to look at the larger screen. It's easier for me to see. Chris T. from Boston. Jane. We don't know where Jane is from, but Jane, we're glad you're joining us today. And Thomas from Rochester. So all of you who are joining us today, we're really grateful that you're here with us, and we're looking forward to hearing from you throughout the webinar.
Thanks, Gil. At South Central Foundation, we have a mission and vision that we use to be the guiding force in how we provide services to our customer owners. And South Central Foundation's vision is a Native community that enjoys physical, mental, emotional, and spiritual wellness. Our mission is working together with the Native community to achieve wellness through health and related services. And these are really big goals, and Karen will share with us how we break those goals down to achievable outcomes.
South Central Foundation's corporate goals are shared responsibility, commitment to quality, and family wellness. We're going to be talking today a lot about our commitment to quality, hiring Alaska Native American Indian people to meet the needs of our customer owners. We're going to talk to you and share with you how we look for best fit to make sure that we're finding individuals from the communities or other communities that will help us achieve these goals.
Karen we shared the mission and vision and the goals of the organization, which is essentially what we're trying to accomplish. But how we're going to accomplish that is through a few principles that we have, and one of them being the leadership principles. And this really is the guiding force in how we lead as in the organization to achieve our mission and vision. A couple examples is operating through the strength of the Alaska Native cultures and traditions within leadership, and respect and grow the skills of future generations and drive initiatives and improvements.
We also have operational principles. Operational principles spell out relationships. We're going to be sharing with you how important relationships are to South Central Foundation, how we engage with our customer owners, and how we select candidates and how they may react in certain situations because of the behavioral-based interview process that we're going to be sharing today. We want to make sure that relationships are fostered between customer owners, the family, the provider, and that they're fostered not only with the community, but also with our community here at work. We're going to look at ensuring that when we make changes across the organization that they're aligned with these operational principles, and that's how we know that we're working towards achieving our corporate goals.
This is a presentation on behavioral-based interviewing, and South Central Foundation is proud of our relationship-based system of care. But not every employee that we hire is on the same page of what relationship looks like and being in relationship looks like, either with each other as employees or also the customer owner. And as part of that, we have core concepts, which that spells out wellness. This also is a 3-day training that all employees go through to learn about how to be in relationship. A couple of those principles are work to grow in relationship, and my favorite, laugh and enjoy humor throughout the day.
So the question that we have for you at this point is, why focus on hiring? Why is it important for you and your organization to focus on hiring? And we're going to talk about some of the reasons why it's important for us, but we want to know from you. So if you could, again, go to Mentimeter, and again, www.menti.com, using that code 657495. Why focus on hiring? Answer that for us, and we're going to look at your responses in just a couple of moments. In the meantime, we're going to share some of the reasons why we focus on hiring.
Why we focus on hiring. Success is largely based on hiring the right people. That's not something new. You guys have probably heard of that many times. South Central Foundation is a unique place to work, meaning that we have different ways of providing care and being in relationship with our customer owners. So we want to make sure that when we focus on hiring, that it's based in our vision, mission, and our values, and our operational principles, and the principles that Barbara and I just shared. We want to make sure that we are creating opportunities for individuals who've worked in the Alaska Native communities to make sure that they're a good fit for South Central, a good cultural fit, meaning that when we are looking at hiring people from the community, that we want to make sure that we're giving them life credit. It may be that they're applying for a manager position and they've been a captain of a boat, so we would give them credit for being a leader in a little different way than we would in most organizations. We want to make sure that we're looking at recruiting in like places. We know that first that people need to be a fit for our community, meaning Alaska could be cold in the winter, and we want to make sure that individuals like cold, like the winter, and can handle what it looks like to be living in Alaska, not only for themselves but also their family. We also want to make sure that people understand that our locations are remote. Alaska is the largest state, and we have many facilities, and we work with over 55 villages across Alaska, as well as here in the Anchorage community. And it is quite remote. We don't have access to a lot of the things that larger metropolitan areas have in the United States.
Thanks, Karen. So let's look at some of the reasons why you focus on hiring. To find the right skill set, I think that's very important. To find the right candidates and to lower overall costs of the organization. I think we'll be speaking about some of that throughout the rest of the webinar. We need to reduce turnover by hiring the people who will be invested. I know we're going to be talking about that, and that's very important. Customer service and safety, I think that's a great reason. Finding the right fit of employees sets the tone for the corporate culture that supports the mission and vision of the organization. Wow, I don't think we could have said that any better ourselves. I couldn't have. The cost and time it takes to rehire when there is a poor fit. Sensing a theme here. We're only as strong as our weakest link, and it's time consuming to get people trained and operating at full capacity. Absolutely, it's investment when you bring new people on, both in time and in funds. And we want to build great teams, and we sometimes have trouble finding talent in our local area. So looking at recruiting, not only locally, but maybe statewide, nationally, internationally, even. So these are some great things, and I think that we'll be responding to a lot of those points through the course of the webinar.
Yes.
Thanks, Gil. One thing that we learned early on is the importance of workforce competencies in our workforce development system. And years ago, we used to have several competencies that were listed in our performance evaluation, upwards of 18 to 22 items. And that was a little difficult for employees to understand and be able to talk about their performance in relation to those competencies. What we learned is that we really needed it to be simple and easy to use. We surveyed our workforce, and we surveyed our customer owners and leadership and stakeholders, and we identified 4 workforce competencies that were important for us to achieve our mission and vision. And these 4 workforce competencies are expected of everyone in our workforce to have at different capacities depending on the role that they fill in the organization. I'll briefly describe the 4 workforce competencies and the definition below them. The first being customer care and relationships. And that's really how you work with the patient or customer owner in the day-to-day interactions and build and be in relationship with the customer. I will also note for customer care and relationships that not everybody works with direct patient care, and so for individuals such as human resources, our customers are really those managers and employees in each of our departments. Communication and teamwork is essentially how you communicate and work within a team within your department and within peers of the organization. Improvement innovation is constantly looking at changes and improvements that you can make either within your direct line of impact or as a leader throughout the organization and within the community. Because ideally the job we hire you today in will be completely different 2 years from now. And we need anyone that we bring on, new employees, to understand that. Because some people just don't like change, and that's okay, but it may not be a good fit for South Central Foundation, and we want them to know that in the beginning. And the final one is the workforce development skills and abilities. And this is the technical skills on how you do your job. So if you're a nurse, it's those technical skills that you learn in nursing school or as a physician. What I like to point out in our workforce competencies is that 50% of our workforce competencies is how you work with others. Again, going back to the core concepts that we discussed earlier, is how do you be and build relationships within the organization and with our community? And these workforce competencies are integrated throughout our workforce development system. So they are in our job descriptions and our performance evaluations as well. So when an individual receives their performance evaluation, 50% is on on relationships, 25% is on improvement and innovation, and 25% is on the technical skills of how well you do your job.
So talking about workforce competencies, we learned lessons along the way. We started with behavioral-based interview questions, and we're going to tell you a little bit about the history. We then realized we needed to decide what competencies we wanted our employees to have in order to make sure that we're meeting our objectives. If you go right now to the internet and you look up behavioral-based interview questions, you'll have lists of 100 examples of behavioral-based interview questions. You'll also get responses to behavioral-based interview questions as well that you can easily find online. What we have done here with behavioral-based interview questions is a little bit different. It's not just asking one question. It's really finding out how the candidate has acted in specific employment-related situations. And we ask them to share their story about how they have acted, what they had done in these specific situations. We believe that past performance is an indicator of how people are going to perform in the future, instead of just saying, tell me if you're a good team player, for instance. We want to give them the opportunity to share their story. Most behavioral-based interview questions are very open-ended. Give me an example. Tell me about a time. Describe a decision that you made when you didn't have all of the information. But it doesn't stop there. We also have to use follow-up questions and specifically ask them to give specific examples of what happened in the past, how did that work, in order to really get to the root competencies that we're looking for the best fit.
So to provide some examples, one of the many questions that we get is, can you show me examples of what behavioral-based interview questions look like? And so for us, we base our behavioral-based interview questions off of our workforce competencies. And really that's the easiest way in order to be able to create your workforce competency or questions based off your workforce competencies, is to identify the competency and identify what type of question would elicit that type of story that Karen just discussed. So for customer care and relationships, a typical question would be, have you ever worked with Alaska Native or American Indian people? And that's very easy to answer, yes or no. However, here at SCF, we want to ask a question that will help elicit a story. So describe a time in your career when you identified a cultural trait in a customer or a coworker. How did you modify your actions as a result of the person's cultural needs? For communication and teamwork, A typical question would look like, how well do you work with teams? My response would be, I work great in teams. However, when you think about how to elicit a story, walk us through how would you handle this situation. It's 4 o'clock and your shift ends at 5. You have a report due to your manager at the end of the day, and another department manager has requested your assistance, and an angry customer is on the phone. That really helps us understand, by answering that question or that scenario, the thought process that a potential candidate would go through in order to solve that situation, and thereby giving us an idea of future decision making based on past performance.
A couple of other examples. Under our workforce competency, improvement, and innovation, how might you handle change? Would be a typical interview question. One that we may ask under improvement and innovation is, tell us about a situation in which you had to adjust quickly to a change over which you had no control. What was the change and how did you react? So we ask many questions at once, and the expectation for managers is they also follow up on those questions. So we may say, tell me about the result of that change. What was your role in that change? Is a way to drill down to really get to the individual and their competency. An example of a question for workforce development skills and abilities. How do you make decisions? What's the most important thing about making decisions? Maybe a typical interview question. How we would ask that here at South Central Foundation, tell me about a time when you had to make a decision without all the information you needed. How did you handle it? Why? Were you happy with the outcome? Is another example. We also may ask follow-up questions about that decision, and do you feel like that was a good decision? Did you learn from that decision? So it's not only that we have the questions, but it's more important to have those follow-up probing questions in order to get to the real story and have people open up and really share a little more about themselves.
So our approach is a team-based system for interviewing. So when we schedule interviews, it's very rare that there will be just one person interviewing that individual. In fact, there might be a whole team of people, including physicians, clinicians, administrative support, depending on the position. But we want to make sure that anybody that would be working with that individual also has the ability to participate in the team-based approach to interviewing. As we also mentioned, we also have a story-based approach. So all of our behavioral-based interview questions start with a base story, and then, as Karen mentioned, that we continue to add questions to that particular story. So essentially, less is more, right? So if we ask 1 or 2 questions for each workforce competency, we may get a bigger and larger story the more questions, follow-up questions we ask. The other is community-based, in that we want to make sure that we have our community involved in those questions. Oftentimes we have to recruit from the lower 48 to bring individuals up to Anchorage. And we want to make sure that they're going to integrate well into our community, and as was previously mentioned, want to live in Anchorage or the surrounding area and make that part of their life rather than just a couple years. We want to be able to create that community and understand what it's like to live and be in Alaska. And essentially, we're looking for right fit. So you can be a right fit for South Central Foundation, but you may not be a right fit for that particular position. And we'll talk a little bit about how we approach that later on in the webinar. But we want to make sure that you're a right fit for SCF, but we also want to make sure you're a right fit in the position that you're at.
One more thing to add about community-based is that in some of our rural communities, we'll work with tribes, so the tribal representatives will also be at the interview. Maybe, Gil, you can share with what your interview was like at your last interview at SCF.
Sure. So when I worked in a clinical role, and not only as somebody who was interviewed, but then as somebody who was part of an interview panel, we had multiple people as a part of that interview panel, and it wasn't just other people who were in the same position. It wasn't just managers and clinical directors or clinical supervisors. It was everybody who might be a part of the team that you were working with. So for instance, in my role as a behavioral health consultant, and when we interviewed other behavioral health consultants, we made sure that we had not only a manager for the appropriate clinic, that's somebody who needs to be there, not only maybe a clinical supervisor who is going to be the person providing oversight for this individual for clinical work, but we made sure that we had providers there. We made sure that we had RN case managers there, because those were the people that the individual who we were interviewing would be providing service to on a daily basis. So it was very important for them to be a part of the conversation from the beginning to determine if this person was the right fit, if they could see this person fitting in well with the rest of that team to provide that service. So it's really, I think, paramount, and I think this is something we do in lots of different ways across the organization here, but it's really important that we make sure that all the stakeholders are at the table for those interviews, not just the people who you might traditionally think of as being an interview, a manager, an administrator. We want the people that are going to be working side by side with someone on a daily basis to be there, because ultimately they're the ones that are most impacted by who's showing up in that new job.
Yes, definitely. I think that we also do the same thing in the human resource department. If we were looking to hire a human resource generalist, in the interview would not only be individuals that they'd be working with in HR, but we would ask operational managers for across the organization from different divisions who are going to be working with those individuals. So I think that it's very similar across the whole organization. I think another unique thing that we do, in addition to the team-based approach or the story-based approach, sometimes we take that story-based a little bit further, and if you were applying for a training specialist, we may ask that in addition to the behavioral-based interview process that we're going to share, that you also provide a training and people are in your teammates essentially are the classroom in which you are sharing a new learning opportunity. So there's many different ways that we do that across the organization.
Absolutely.
So let's start from the beginning. Let's talk a little bit about our history with behavioral-based interviewing at South Central Foundation. So it was developed from an industry best practice, and we decided to test it with one small group, nurses. So registered nurses, certified medical assistants, and licensed practical nurse. What was happening in our community at the time is there was a shortage of nurses. We're in healthcare, and we were competing with other local hospitals, and it became a concern because we had a small pool of candidates for lots of positions, not only at our location but at other local hospitals here. And we needed to figure out a better way of selecting and interviewing candidates in order to fill the positions. And we wanted to make sure that it was an improved fit as evaluated by the manager, meaning that recruiting and the individuals who were part of the recruitment team were really making a good match, and the manager thought, this is somebody that I really like and they really like us, and we're excited to have them as part of our team. We also wanted to make sure that we were making better decisions to hire. So oftentimes in a shortage of nursing, for example, sometimes it's just important to get bodies. And some of our operational managers were really wanting to just select somebody to fill the position because we couldn't provide a certain level of service if we didn't fill our position. And they became panicky, and that became a concern as well. And we wanted to make sure that we were making better decisions because we didn't want an individual just to be here for a couple of weeks, then to turn around and say, this isn't really what I signed up for. So we believe that if we make and take more time selecting those individuals, that we would have increased retention.
Increased retention is something that we monitor at South Central Foundation regularly, and we started implementing behavioral-based interviewing in about 2006. And to be completely transparent, we didn't get really good at looking at turnover until about 2008. But it's estimated that our turnover rate in 2006 was upwards of about 50%. And as you can imagine, an organization that was growing so fast, the 50% turnover rate, was pretty impactful. We piloted the behavioral-based interviewing in 2006 and implemented it in about 2008 to the rest of the organization. So all positions of the organization were now using and implementing behavioral-based interviewing. Now, we can't contribute the decrease in turnover rate completely to behavioral-based interviewing because we were working on other improvements in our workforce development system that can contribute to this, but it definitely was one contributing factor into reducing our turnover, is hiring the right fit for the right job.
So we want to build on the conversation that we've been having thus far and start talking about hiring tools. And we've kind of touched on some of the hiring tools, the behavioral-based interviewing, team-based approach. We've talked on some of that. We've touched on some of that somewhat, but we want to know, what hiring tools does your organization provide? And again, we'd like for you to respond using Mentimeter, and you can again go to menti.com using that code 657495. What hiring tools does your organization provide? And for instance, some of the things that we use on a regular basis, the tools we provide to our the folks that are hiring people, team-based interviewing, we've talked a bit about that already, and we'll talk more about that. Centralized panels, core questions and supplemental questions, and I think that's where we get into some of the flexibility with how, depending upon position that's being recruited for. We have checklists that help us determine, do we have all the information we need? Scripting that helps people know how to engage in the interview process. And then training and coaching, which also does more of that, really gives people a skill set for interviewing. So these are some of the tools that we provide. And we're going to be spending some time talking about each one of these through the rest of the webinar. We'd like to know, what are some of the tools that you provide? So we have a response here. Applications through a third-party website. We have a one-day orientation for clinic workers. It helps them with the EHR, with the electronic health record. Okay. Scenario-based training for interviewers. I think that's a great thing. We train managers in interview process. So it sounds like a lot of investment in giving people the skills and the tools they need to be able to interview. We try standard interview panel approach, but struggling with turnaround times because of availability. Okay. Standardized questions for various positions. There's a list of standardized and recommended questions and a guide for evaluating the applicants. That sounds similar to what we have. And onboarding policies and procedures and hiring guides. Okay, so it sounds like a lot of investment across the board in making sure that people have the tools and the skills they need to interview and make sure that they're looking at how they walk through that process with people that they're interviewing. Really important stuff. So we're going to spend some time now starting to talk about the tools that we use.
Yeah, we already mentioned our team-based interviewing approach. I'd like to give probably one more example. We currently have a vacancy for a human resource information specialist that we're looking for. And that is somebody that will help the human resource department manage our database where we keep all of our employment information. So we're setting up interviews and we have candidates that we're looking at, but it's not just the human resource department that I had mentioned. We also will include the IT department, because this individual is going to have to work very closely with the IT department, and also data services. We have a data services department that helps us give our turnover data that you just saw. So they'll be partnering with us in order to make sure that we're getting the best fit for not only the HR department, but somebody who's going to want to be in relationship with the IT department and with the data services department, for example. The other thing that I'd like to say about team-based interviewing, there are often times where here at South Central Foundation that you'll go through more than one interview. I would say that it'd be pretty rare that an employee would get hired just after one interview process. Sometimes departments would like to, with their team-based approach, first just have that department and the multidisciplinary individuals within the department, like an admin support, a program coordinator, and like we had mentioned earlier, participate in the first round of interviews, and then just the top candidates, the top probably 2 or 3 candidates, where we would invite our key partners and other department individuals to participate in, is often how South Central Foundation department managers make sure that they include their key partners. One thing that I'd like to share about customer owners, those customer owners, we have over 50% of our employees are Alaska Native American Indian who are customer owners. So we also have those customer owners, or those employees who are customer owners, participating. So it's really community involvement in helping select who is going to be working here at South Central Foundation.
One improvement that we made was working towards centralized interviewing panels. And to describe what centralized interviewing panels are, we're going to first describe decentralized interviewing, which many of you may experience in your current jobs. So for example, we have an applicant who's in green, and we have multiple job postings on the website, for example, an RN case manager. And the postings are for every department that is looking for an RN case manager. So that particular individual may have 3 applications out there. And as a result of those 3 applications, they get 3 separate interviews, already looking inefficient. If the manager decides they would like to do references on those 3 individuals, then they're required to do 2 references for their last 2 employers, which essentially means that we, South Central Foundation managers, are calling the same employers 3 separate times. And this can lead to a lot of frustration in result of the applicant, the interviewees, or the interviewers, and the individuals that we're conducting reference checks on. And essentially, the person who got the job was the manager who got their hiring packet to Human Resources the fastest. And this became a first-come, first-served methodology, which didn't always fit with our right fit approach, right? So we were making decisions not on best fit for South Central Foundation, not on best fit for employee, and not necessarily best fit for the specific department that they're looking for.
So our solution to that was to have a centralized interviewing process. What did that mean for us? That meant that we were going to have an interview team, a multidisciplinary team from all over, interview the candidates once. One that could set, some of the resistance was to the centralized interview process from operational managers is, how am I going to trust somebody else to select somebody for my team? How are they going to know? And then what we did was we asked for those operational managers to send individuals to participate in this central interview process. So now we have that same applicant. They apply online, and all the central interviewing panels say various departments. So if you went online and you looked at our job openings and it said various departments, that's an indicator that it's a central interview or centralized interview process, and the department usually says Human Resources. What would happen is Human Resources would screen the candidates, and we would schedule time on a specific day of the week where those interviews happen. Those managers would come to the conference room. They would select, and instead of having the first quickest manager to get the job done or to get the interview packet and the reference checks to Human Resources, they come together as a team to make that selection. And they get references once instead of having 6 managers or 3 managers call to get references. It was often confusing for candidates because there was a large nursing shortage. I'll share that with you. At the time that we were starting central interviewing processes, they would say, they would call Human Resources. I got called for an interview, or I got called for this interview and I don't know where to go. So we've made it simple and less confusing for the candidate by having a central interview process, and we believe that the interviews become a little bit more in-depth because of the behavioral-based interview process. What happens at the end of a behavioral-based interview process, that best fit that Barb had talked about, if we think the nurse is a good candidate not only for pediatrics and OBGYN, HR would give an offer for both of those locations, and it would be the candidate's opportunity to make the selection on where they'd like to work.
And the other thing I'd like to add on centralized interviewing panels is we have been blessed before of having all of our positions filled, and yet we might have a very strong candidate that would be a great fit for South Central Foundation or a great fit for the department. And maybe there isn't a position for them to be put in. And we've had a couple options that we do have available for our departments. And one of those is we can create a wait list. So meaning that they've already been through the interview process, we've already done the reference checks, and when there is a position available, we'll be happy to call them. The other option is if the department or the division has capacity and would like to do so, we'll do an overhire and we'll bet on our attrition rates that we'll be able to place that person in a full-time regular position with a team in a certain period of time. But in the meantime, we can hire that employee, get them trained, get them partnering with different individuals and really learning how to be an employee at SCF. And thereby, when we have somebody that leaves the organization, we have somebody that can jump right into that position when needed. So that is some of the advantages of really having that centralized interviewing panel as well.
An example of a wait list I think that we have right now is supervisors. We have a centralized interview process for supervisors and managers, and currently we have not had any openings because of our high retention rates, and so we currently have a waiting list for supervisors. So good point.
Now, moving to a centralized interview process wasn't easy, and I think on the Mentimeter somebody said that time was an issue, and Karen did respond to that our approach to time was to make sure that that time is reserved for managers. The other problem that we encountered, pushback from managers, was how is somebody else going to make the hiring decision for my department? If I'm going to be having direct supervision of these people, how are they making the decisions for me? And we approach that in several different ways. We have been able to implement the centralized interview process through many positions, but to answer really the problem of hiring somebody else making my hiring decisions is that we'll have multiple phases of interviewing process. So the first phase, if you will, would be the first interview that we had talked about before. And this would be, again, multidisciplinary team members coming in and doing an initial screening check to see if they're a good fit for South Central Foundation and the position in general. The second interview could be a position with a department manager and teams within that specific department that they're considering placing that individual into. And therefore, we're making sure we have a right fit for South Central Foundation, the candidate, as well as the department manager. And then they also have some hiring decision making as well, some authority over those positions. We've been able to implement the centralized interview process for many of our positions at SCF, including our RN case manager positions, clinical associate and mental health workers, master's level clinicians, and even our administrative support training program is all done through this centralized interview process. I will note that this isn't always the best process for one-off type positions, or if you're just looking for one person and that position doesn't turn over very frequently. If you're looking at implementing a centralized interview process, the first bet would be to look at the positions that you have the most employees in, or perhaps the most attrition. So it wouldn't be the best idea for all positions in your organization, just potentially the highest utilizers.
So let's go into a little bit more detail about the behavioral-based interview tools. So we've tried to make it easy for those teams who are doing interviews by making sure that we provide examples of core questions. So what we have also done is been very transparent when it comes to our interviewing tools, meaning that if you go to our website or our internet, if you're an employee here, you can pull up the core questions, you can pull up supplemental questions. We have made it easy for managers and easy for employees who currently work here who may want to interview for other jobs to have access to what those questions are. We use a set of core questions for all positions at South Central Foundation. As we had mentioned before, those core questions, our behavioral-based interview, are tied to our workforce competencies, and we'll give you some additional examples of that. We've also been very, I would say, strategic when we're looking at providers, management, and certified medical assistants. We have core questions for those specific positions because how people work here at South Central Foundation as a provider is different than many other locations. So we've made it easy for managers to make sure that the questions will elicit our team-based approach to care for providers and the expectation for management. The certified medical assistant and licensed practical nurse, how they work here is very different than they work other places in our community because of the team-based approach we have. So we have added supplemental questions and standardized those for positions where the work is different than you would typically see in other primary care settings.
So at South Central Foundation, we kindly refer to ourselves as a family, right? And so when you prepare for an interview, it's very similar to how you would prepare for a family event. And before, you want to make sure your environment is right. You want to make sure that you're prepared. During, you want to make sure that you're a good host and that you allow the people grace and time to be able to share their story and be heard. And then following after that, you may want to follow up with individuals to make sure that they have everything that they need. The same would happen in the interview process. So before the interview process, we have a checklist for managers to go through to ensure that they know what's expected before, during, and after a candidate is interviewed. And that includes ensuring that the room and the environment is right, making sure that the individuals that need to be interviewing the person, so the team-based approach, everyone's invited and had been confirmed for that particular interview. And the other part is making sure that all the interviewers know what questions are going to be asked. So like what was mentioned before is that we do have several interview questions that could be available to be asked of the candidate, and yet we only want to have 1 or 2 questions per workforce competency. So ensuring that the position that you're looking for and the questions that you ask and the competencies that you're looking for in that candidate all in line. And that's very important to do before the interview. During the interview, once your candidate shows up, it's also important to make sure that you introduce the candidate into behavioral-based interviewing. If they're not used to behavioral-based interviewing, it might be hard to want to tell a story about yourself, right? They're used to traditional interview questions, yes, no, great, fine, where we really want to create a story. Sometimes we have to allow the individual grace, and we will let them know that if they have difficulty finding a story that has actually happened to them, just to let us know. And we'll give them a little time to think about it and formulate their thoughts, because that is a little bit more difficult to put together. And again, also coordinating with your team members on some potential follow-up questions and working with each other during the interview on those follow-up questions to make sure that everyone understands the entirety of the story. Following the interview, you want to make sure that you prep the applicant of what comes after the interview. So if they are not selected, what will happen? And if they are selected, what to expect next in the process. And make sure that you answer any questions. Following the interview, we debrief when we schedule time in the interview process to ensure that we have time to debrief as a team and make a team decision on the next steps. So whether there's a selection for a next interview or a non-selection for the position. But you want to make sure that you build in that debrief time, because that is essentially very important to be all on the same page and reach consensus.
In addition to the checklist, we also provide scripting for managers. So Barb gave a wonderful example of during the interview, we would share with the candidate how our interview is different from other organizations. But we make it simple for managers, and maybe not only the managers, because remember we do team-based interviews, and our individuals who are interviewing may not always be operational managers. So for a nurse who normally doesn't do interviews on a day-to-day basis, we provide scripting as part of our interview packet to remind individuals and to make it simple for them to give words to the candidate about how we're going to be doing things a little bit differently and explaining the process up front. And we provide that in our interview packet. And the scripting is also part of how we teach and train individuals to participate in interviews.
Another a tool that we have for our managers is training and coaching. And it's important that some individuals, like Karen said, don't do interviewing day in and day out. For example, the RN case manager. And if they're new to South Central Foundation, the only interview that they may have experienced for behavioral-based interviewing may have been their own interview being hired onto SCF. In that case, the operational managers would be responsible for teaming up with experienced interviewers to make sure that there's experienced and new interviewers on the interview panel as well. And they can provide that ongoing coaching and training for new interviewers in the process. Part of that is teaching them that being comfortable with silence is important. So giving the candidate grace to formulate their thoughts, put it together, and then come up with a response to your question. Another is focus on acquiring information regarding the past. It's very easy to jump right to what they think they should do based on a scenario rather than sharing an actual situation. So identifying prompts to give the candidate the opportunity to be able to reflect on past behaviors and performance as well. We also want to train and coach interviewers to not prompt or give examples of situations that may have had in the past, because everyone has their own story to share and we want them to tell their own story.
There's often times when I've been part of a team of an interview where an individual says, oh, this is what I would do if I was the manager and I had a change that I didn't agree with. This is how I would handle the situation. And that's what we teach and coach, as Barb had mentioned, how to ask for specific examples. So you've just shared how you would do it if you were the manager. Can you give me a specific example of when you were a leader on a team and maybe not the manager? There's different ways to probe and get that information, and that's part of the training and coaching that we provide to individuals who are going to be participating in interviews. We also have our interview packets as another tool. We believe that that's an important piece to the behavioral-based interview process. What is unique about our interview packets is we, again, have that broken down by those 4 workforce competencies that we want all employees that are selected, or all candidates that are selected to be employees meet. We've made it easy for managers with those workforce competencies to say, what are we looking for in the candidate? How do we know what traits are they going to be sharing that we want to make sure that are aligned with our vision and mission and our workforce competencies so they're a good fit here. And you can see we made it simple. We put check boxes by all of those traits under customer care and relationships. The ability to adjust to cultural differences. Demonstrates effective listening skills, customer focused, recognizes our patients as customers is very important under customer care and relationships. And right underneath there are 2 examples of questions that we would have. And as the candidate is sharing their story and we're drilling down and asking for those specific examples, managers, all they need to do is put a checkbox next to those competencies, and that will be a good indicator if they're going to be a good match.
One of the important pieces of the behavioral-based interviewing packet is also our rating system. What you see on the screen is an example of our cover sheet that goes in front of our behavioral-based interviewing packet. And at the top you can see that it has the overall rating, which allows the manager to rate the candidate on a scale of 1 to 5. So when comparing multiple candidates for a position, they have an idea of what that individual rates for themselves. And each individual interviewing is asked to complete a cover sheet. We also ask them to identify particular strengths and concerns for that position. And we want them to address any strengths and concerns because if that individual is hired, they want to be able to address those strengths or use those strengths as an advantage to the organization, but also be able to be aware of the concerns. And not that we wouldn't hire anyone with any concerns, it's just to identify those proactively rather than when they're already here. Another item to point out is in the bottom right. If the person is a good fit for South Central Foundation, but not necessarily a great fit for that specific department or that specific role, we want them to recommend positions or roles that the candidate could fill at SCF. If they're a good candidate for SCF, what other jobs can we refer them to? Human Resources will then take that information and contact the candidate to let them know that if those positions are available and the recommendation. Additionally, if there's any additional comments, they can add that to the bottom of the evaluation sheet.
One of the example that I have in regards to would you recommend the applicant for another position, there are often times where as Barb said, we know that they're a good fit for South Central Foundation. They're just not a fit for this position. HR does a good job of contacting those candidates, but because we're in relationship with our peers and our managers, most recently as part of the centralized manager panel, I don't participate in that interview process as the HR director, but I had a manager of a primary care clinic said, we're interviewing somebody today that has a lot of HR experience. Do you have any HR openings? So even our managers are looking out for each other because we are in relationship, and unfortunately we didn't have any HR openings, but I said, let me know how the interview goes. And so our managers also reach out to individuals. I've been working here for quite some time. I know a lot of the operational managers, and I would say probably about once a quarter I'd get a call and say, hey, are you looking for somebody? We know somebody who was an operational manager or who's a program coordinator who may be a good improvement specialist, or do you know of any openings? So I don't think that's unique because I work in human resources. I hear other individuals across the organization having those same conversations.
So we'd like to open up the conversation at this point and see what other questions you may have. We've covered a lot of information today, and hopefully we've answered a lot of your questions, but there may be other questions that have come up through the morning, through this training that we want to make sure we take some time to respond to. So if you can think of any questions you may have, we'd like to hear from you right now. You can go to menti.com, and again using that code 657495, and you can respond to those to this question. Let us know if there's any questions you have that you'd like to know more about right now. We'd love to hear from you, and we'll look at those in just a moment. I think that maybe while we're waiting for responses there, I have a question that came up. Something you were talking about earlier prompted this for me. You were talking about the time when we were hiring, and there was a significant shortage of nurses, and we were really working to figure out how to recruit nurses. I know that one of the challenges, especially here in Alaska, has been recruiting physicians, especially for some of our rural areas, some of our more remote areas. And so what are some of the things that maybe we're doing differently to kind of meet all of those things that we've talked about in order to recruit folks that are going to want to come here and are going to be the right fit?
Yeah, that's a good question, Gil. We recognized that we had a little bit of difficulty recruiting physicians, and one thing that's very important to us is that they want to come here, and they want to live in Alaska, and they enjoy the outdoors. Their family's going to want to live here for an extended period of time, because when you think about a relationship-based system of care, that really means that the healthcare provider also needs to stay in the organization as well. So one thing that we recognized is the importance of building teams and relationships through creating work groups. And these work groups were team-based, which has been a common theme throughout this webinar, with individuals not only from recruitment, human resources, but also operational managers and the physicians themselves. So we got them in a work group and identified what was important to them as new physicians coming to Alaska and to South Central Foundation. What was important to you, and what were you looking for coming in here, coming to work at SCF? We identified those items, and as a result, we created a new landing page, was one of the outcomes on our web page that really specifically targets why our physicians want to stay working at South Central Foundation.
Okay, great. Thank you. And we have some questions from our participants. We'll just kind of go through these. What challenges did you have when switching to centralized panels? How did you get managers on board?
A very good question. I think that it was a challenge. As I had mentioned earlier, for centralized panels, there was a little bit of resistance from operational managers to say, how am I going to trust the process? Meaning, do I really think that they're going to be able to make a good selection? How do I know that they're going to check the references? And what we reminded those operational managers about is really the first importance for us is, are they a fit for the community? Are they a fit for the organization? And then we'll talk about the fit for the department. So what those centralized panels are really doing are saying they're a good fit for our community, they're a good fit for our organization, and we believe that they're going to be a good fit for pediatrics, and these are why we think that this particular candidate is going to be the best match for peds, for example. The other thing that we did to kind of help with the resistance from operational managers is we said, we can't do it without you, right? We need you to participate, and we need you to send your best individuals on your team and people who you trust to make that decision on your behalf, or come yourself. And that once they, and often when we were first kicking this off, the manager came because they were like, I need to figure this out, and I need to make sure that I trust the process. And as we got more buy-in from participating in the centralized interview process, they started sending other people from their departments to represent them, to be the best person to make the selection.
Okay, great. What differences, if any, are there to the application process as far as pre-interview?
For pre-interview, we have the same application, so no matter if you're Alaskan Native American Indian or non-Native, or what position you apply for, or whether you're in a centralized interview panel or not, our application process is the same. So you don't fill out a different application. Even if you're an internal employee, I think that gets a lot of questions as well, is what we have the same application process, so everyone needs to apply for the position. And then it depends on which position you applied for. For example, if you applied for a centralized interview panel, it might be a pre-interview, which could be a phone interview. It could be a face-to-face interview with a smaller panel like we had talked about before. And again, if it's not a centralized interview panel, it might be individuals and teams within a department that's interviewing. So the application process is the same, but after the interview processes may vary depending on the type of position.
With the application process, sometimes there's screening. When you apply for a job online, there may be some screening questions that we prompt them to ask at the very beginning, even before they get interviewed. Yep. So depending on the position.
Okay. Who helped decide what competencies would be standard for your organization? Mm-hmm. What was that process? We don't have anything like that.
So years ago, we had a list of competencies, and that came from part of our evaluation process. Really, we said that this is what we wanted everybody to do and have as far as skills at South Central Foundation, and that was important to us. So we took this whole laundry list and had an improvement team, project team, to look at those, and they kind of put them in buckets. And at the time, we just called them buckets, and we called them buckets to make it easy. But it was a whole list of like 20, 18, I don't remember. There was a huge list of competencies. And we decided to just put them in buckets, and then we began the process of defining what those buckets were, meaning what are the big categories of competencies that we want. And at that time, we had focus groups, and we asked managers, we asked customers, we asked leadership on what they thought the name of those buckets should be, got that feedback, wordsmithed it, and then ran it through what we call our functional committee structure at that time to finally whittle it down to the 4 workforce competencies that we have today.
Okay, great, thank you. This is a really good question. What happens if the interviewers strongly disagree about the fit of a candidate?
So I will, she looks at me. Maybe I have, it's a very good question. I think that if the group strongly disagrees with a candidate, then, I mean, that's why we schedule time in the interview for the debrief, to talk about the candidate after the candidate leaves the room, to really come to consensus on, is this person going to be a good fit? Oftentimes when people strongly disagree, then it just means we need to inquire and have more conversation about why there's differing views. It may be that that individual is a good fit for the organization, but just not for this particular position. In most cases, when there's that big of differences between the interview team, more than likely that individual is not going to be selected, but more than likely that box on the bottom of the page would say, this person would be a better fit for this position, and these are the reasons why. We really try as a team to come to consensus, and when we're in the interview process, we don't want to have to convince ourselves that this person is going to be a good candidate. You're going to know automatically. And if you're already questioning that, or other people on the team are questioning that, that's an opportunity to say that maybe this person isn't the right fit.
Okay. We are a small tribal organization. How do we get started on a small scale when not everyone has bought in?
I think that's a good question. I've had that question before, and what I would recommend is that even though you're a smaller organization, or if you're just a single manager in a very large organization and you want to use behavioral-based interviewing questions based on workforce competencies, where I would start is identifying what competencies you're looking for as an organization, or even just in the position. Right. And if you identify just a couple workforce competencies, then you can develop your behavioral-based interview questions based on those specific competencies. And then essentially you're doing behavioral-based interviews based on the competencies that you're looking for.
Okay. We have a backlog from a lack of succession planning. How do you approach hard-to-fill position vacancies such as providers and float nurses? And I think we've spoken to some of this already, but is there anything additionally that would be important for folks to know?
So there's a couple of different ways that we approach hard to fill position and vacancies. The example that I can give years ago about nurses when we first started team interviews, there was a big nursing shortage, and it was the fastest person got the job, and we realized that we were interviewing candidates who had interviews at the other local hospitals that same day or the very next day. And we realized that we weren't making those offers in a timely manner. So we did several different PDSAs at the time in order to make same-day offers. And we needed to do that at that particular time in our community because the shortage was so high. So oftentimes when there are particular needs in a community, we would try things and do small tests of change, or PDSAs, in order to make improvements. What we did at that time is we would interview, the group interview, we would go through the interview process for nurses, and then we would say, thank you, we'd like to take you on a tour. And they would take that nurse on a tour while the rest of the team was debriefing and making a selection. HR was participating in those nursing interviews, and we had already calculated an offer. And so when the person came back from the tour, we would say, we'd like to make you an offer pending reference checks. This is what your offer would be, because we knew that we were competing with nurses or other local hospitals for a very small pool of candidates. That helped, and we did that for quite some time, but we don't continue that process because we realize now that we have a different type of nursing job that's more desirable than the other floor nurses, because they're case managers. They have a typical schedule from 8 until 4:30. It's team-based. So now we're marketing that in a different way and not doing those same-day offers the way we used to years ago for that particular moment or that particular need. So I would say that one of the things that we do for those positions or vacancies that are hard to fill is we have different improvement cycles in order to figure out what is going to work best. Barb gave a good example about the physician recruitment team that came together that had new individuals who were participating. An example of that team that came, ideas that came out of that team were vignettes, meaning that we had providers saying what it's like to work here, and then we've put them on our recruitment site. And that all came from individuals who are just out of residency and why they came to work here and why did they want to come to our community. And that's another example of when there's hard to fill positions that we get individuals from across the organization, people in those positions, people who have left, bring the data together and do PDSAs to meet those needs at the moment. And the ones that are successful, we continue to implement in other positions.
Okay. We have two more questions, and there's some overlap in them. It really is about the time commitment for this. First one is, how much more time do you spend recruiting and hiring now compared to before you implemented these changes? The next one is, how much time do you typically allocate for interviews? What variables might affect how much time you schedule for an interview? So kind of both the before and during of the time for the hiring process or the interviewing process.
So the time that we take for interviewing and hiring, I can say that we take a lot of time. And we want to make sure that we make the right decisions. So while it does take a lot of time and investment from your staff to have, and Gil shared earlier, physicians in an interview panel, that takes time out of clinic, which impacts services to our customer owners. But what we'd rather do is take that time in the beginning rather than paying for the repercussions of not a right fit in the end and then having to manage that process. So making and investing in the time in the beginning is much more important to us, and we're willing to take that investment. And it is hard. It's difficult on the staff to take out of clinic particularly or out of our day to make those hiring decisions, but we choose to do that. And we typically allocate for an interview, for administrative positions, it's anywhere between an hour to an hour and a half that we make sure that we have enough time for debrief. Again, you want to make sure that you have that built in there, or if you do run out of time, because some people can be very windy, that you do schedule a follow-up meeting with the interview panel to make sure that you're in consensus with your decision. And again, back to that, what happens when you can't make a decision, right? Making sure you allow for that time. Some of the variables that could impact whether or not that time changes could be the position. If you have a physician that's coming from the lower 48 visiting Alaska and they're not very familiar with Alaska, let alone South Central Foundation and how we provide services and how we provide services differently from other organizations, we want to make sure that we have enough time for them as well as they have enough time for us to ask questions. So their interviews could be a day or two long, as well as allowing time for them to explore the community. So their stay could be a few days to allow for that time. Do you have anything to add, Karen?
I think you answered.
Okay, great. So we're going to start wrapping up here, but maybe can talk about some of the lessons learned through this process of getting to where we are now.
Yeah, I'd like to say that we're still learning. We've given some examples of improvement teams that we have right now looking at physician recruiting and some changes that we're adapting. But some of the lessons we learned implementing behavioral-based interview years ago was the first step was competencies. We didn't start with our competencies. We started with what are the questions, and we kind of backed into and realized we really needed to spend some focused energy on what are we really looking for in an organization. What do we want all of our employees to make sure they have as far as competencies? So we first started with the questions and then learned to start with the competencies. And that really solidified kind of our additional tools that we created as far as the interview guide and the scripting after we came up with the competencies.
And also our selection process needs to be customized for different roles, and we learned that early on. Not every position is a candidate for a centralized interview process, and then who you have in the interview as well. We need to make sure that we look at the position from an organizational perspective, but also from a department and position perspective in learning how to customize the interview process.
Past behaviors predict future success. We had learned that, we had created an interview packet, we had trained managers, and we still weren't getting, our turnover was still high. So there had to be some more training associated with how to do the interviews and how to really drill down and get to those specific details from those candidates on how they've handled situations in the past. And that means maybe asking the same question 2 or 3 different times in order to get that information.
And BBI and interview panels are a huge time investment, as I mentioned before, and really being willing to invest that time in the forefront so you don't have to manage it after the employee has already hired not somebody that may not be a right fit.
And better fit, better retention. So we know that if we're making a better fit for those candidates, our employees are going to be staying here for a really long time. And that, of course, reduces cost, and there's a lot of benefits from having high retention rates.
Thank you. So we're getting close to wrapping up this webinar. We want to let you know that this webinar, as well as other webinars in our growing library things, are available online at scfnuca.com/trainings/webinar. And this webinar will be available for viewing on demand very shortly. There are other webinars that we have completed already that are available for viewing on demand. We are constantly adding webinars to our library, both as live offerings, and then once they've been completed, they become video on demand offerings. There are also other training opportunities both here in Alaska and in other locations that you may want to explore, and you can find out information about those as well at scfnuca.com. And we hope you'll take advantage of those resources and learn more about the NUCA system of care. On behalf of our presenters, Barbara and Karen, and for myself, we'd like to say thank you for joining us today. We hope that this has been beneficial for you and that you've learned more about the NUCA system of care, and how to take some of the things that we've learned and apply them in your setting. Again, thank you so much. Take care.